Exercise is a vital factor for many people in staying healthy, feeling younger, and maintaining optimal weight. Although exercising is generally a good thing to do for your health and happiness, sometimes it can be difficult to start or keep up with a regular routine. It can also make you feel worn down as you work hard. Physical therapy helps people who have knee problems by introducing light exercises into their daily routine that will help improve their joints without the need for surgery or other invasive procedures. These exercises are gentle enough so that most patients should be able to handle them without pain. Physical therapy can also provide patients with valuable information about how to move better, so they won't experience future complications from arthritis or joint disease later on in life. Physical therapy is a hands-on process which generally occurs in one of two settings. The first is at home, whether in the doctor's office or at the patient's home. The other is at a physical therapy clinic, where patients receive one-on-one treatment with a physical therapist, PT. Patients can typically walk independently after physical therapy if the exercises are done correctly. It may take up to 6 months for physical therapists to see the results of their exercises through increased leg strength and flexibility. Before starting your diet plan, don't forget to smash the subscribe button, so we'll be able to give you more videos and diet plans. The goal of physical therapy is to make it easier for patients to perform everyday tasks like walking, getting dressed, and climbing stairs. These simple activities have become difficult for many patients who are suffering from knee arthritis. With help from a physical therapist and exercises to strengthen the muscles around their joints, patients may be able to walk normally with little or no pain. During therapy sessions, the physical therapist will use various techniques to learn what works best for each patient. These techniques may include direct muscle stimulation, electrical stimulation, heat treatments, and cold packs. The PT will also watch how the patient moves in order to correct the patient's posture and improve their range of motion using their knees. How many sports sessions do you need in your daily routine? The answer depends on what you want to achieve. In fact, the requirements may differ between an amateur and a professional athlete. If you have never tried sports, this should be indicated in light workouts of 20-30 minutes 3-4 times per week. If you are a recreational athlete, it is recommended to exercise for about 45 minutes 6-7 days per week. For young athletes who want to become professionals and achieve excellent results, the number of hours in training increases significantly. The daily proportion of training sessions is at least 2 times longer than that of amateur athletes, and the weekly training volume is 7 times larger, or even more. Training sessions should be divided into 3 main parts. Warm-up. Training itself. Muscle recovery and mobilizing. Warm-up of 2-6 minutes is required before the training. The main objective of the warm-up is to prepare your body for intensive physical exercise, to activate metabolism, increase blood flow, bring blood pressure and heart rate to normal values. In addition, warm-up should prepare your muscles for stretching exercises and joint movements that are supposed to come later during the training session. In order to achieve these objectives, a quick walk on a treadmill or running in place is recommended. The principle of warming up consists in gradually moving from light-intensity activities to more vigorous ones. The duration of the training session ranges from 10 to 60 minutes and may differ depending on the type of exercise. Long training sessions, 60-90 minutes, are usually required for activities that require high strength and flexibility, such as throwing or catching in sports, dancing in dance or martial arts, and fencing in fencing. To achieve good results, the volume of training is around 8-12 hours per week over a period of 6-12 weeks. Specialists recommend 20 to 30 minutes per day of training, 3 or 4 times per week. A certain degree of muscle fatigue is accepted during sports exercises. During intensive physical activity, during which movements become more complex and significantly demand maximal physical effort, e.g. jumping, sprinting, the muscle works less efficiently and its work is significantly reduced. At this time, the athlete is stimulated to go on by increasing the beat frequencies or heart rate, which leads to an increase in blood pressure. This process also affects the brain. During training of certain sports disciplines, a similar effect occurs as when taking psychostimulating drugs that affect mental processes. If you are passionate about sports and want to improve your results, you should follow these recommendations. Recovery after training plays an important role in achieving the desired results. Several options are suitable for each athlete: massage, heat treatment, or cold shower. Diet should provide 70 to 80% of the daily energy needs of the athlete. Just as in any other physical activity, in sports, the most important fuel is glucose. Glucose is mainly metabolized during exercise with the participation of muscle glycogen, which is produced from dietary carbohydrates. Low muscle glycogen levels lead to insufficient energy supply and compromise training results. For this reason, carbohydrate-rich foods are required for athletes who want to achieve spectacular results or train for hours at a time. The main source of carb loading during physical training should be pasta, rice with vegetables, and potatoes. To stimulate muscle glycogen synthesis, it is better to eat large portions of carbohydrate-rich foods 2-3 hours before the start of training. In this case, the body will already prepare itself for physical activity, and within a few minutes after starting training, the athlete will not need to feel hunger pangs. During training sessions, athletes should drink as much as 2 to 3 liters of liquid with a carbohydrate content to maintain health and normal blood sugar levels, glucose. In general, during long-term intensive physical activity, glucose is provided through gluconeogenesis in the liver and muscles. The process is called lipolysis. Nutritional supplements, e.g. creatine, carbohydrate, protein, may be useful for athletes who need to achieve good results in competition or training. These products should be added to the daily diet after consulting with a specialist, since they can have side effects on health and nutrition. Remember that avoiding injury is essential. Proper preparation and careful training are the guarantee of safety. Athletes who do not respect your body's normal recovery process, e.g. running non-stop for hours, damage your muscle tissue and cause micro-tears that can increase your risk of sustaining an injury. Proper warming up and cool-down procedures have proven to reduce injuries and strain. Let's not forget about proper nutrition. Certain foods, eggs, nuts, should be avoided in the period before training. Practices such as stretching and joint movements, e.g. yoga, dance, and martial arts, are useful to prevent injuries. I hope you enjoyed the first video of this new How Much Exercise Do You Need series, and that you learned something about the benefits of sport in your life. If you have any questions, feel free to leave a comment below. Also, don't forget to let us know if this worked for you and how it affected your body. Thanks for watching this video, and if you want more videos on how to boost your metabolism and lose more weight, make sure you subscribe so you don't miss out on future videos.